Welcome to Concept in Medicine. In today's session, we'll be looking at the Alvarado score. Let's first of all get to know what the Alvarado score is. So the Alvarado score is a clinical scoring system used to diagnose acute appendicitis and also to determine the treatment modality. Now let's look at the component of the Alvarado score. The Alvarado score is also known as the Mantrels score. Why? Because the components of the Alvarado score have been put into an acronym known as the Mantrels. So to easily remember the component of the Alvarado score, we say Mantrels. Because of that, the Alvarado score is also referred to as the Mantrels score. But standardly, it is the Alvarado score. Let's then move ahead and look at the component of the Alvarado score. So for the component of the Alvarado score, we are going to use the acronym Mantrels. So let's start first with the first letter of the acronym. So the M that we are having will stand for the migratory pain. Migratory pain. The migratory pain means that the pain will start from the periumbilical region or within the center of the abdomen and migrate towards the right iliac fossa or the right lower quadrant. So the patient will describe the pain as starting off within the center of the abdomen and then moving towards the right iliac fossa or the right lower quadrant. That is what is described as a migratory pain. And if the patient describes such, then we'll give a score of 1. Why does it have to start from the center of the abdomen? Because remember that the sympathetic nerve fibers that supply the appendix are derived from the 10th thoracic segment of the spinal cord, which corresponds to the umbilical dermatome. And mid-gut structures, of which the appendix is part, anytime they are inflamed, where the pain that will be generated will be of visceral origin, will be referred to the center of the 10th thoracic segment, which is going to be around the umbilicus. That is why in most patients, initial pain in appendicitis is of visceral origin, meaning that they will be referred towards the center of the 10th thoracic segment, which is going to be around the umbilicus, and they get to migrate towards the right iliac fossa or the right lower quadrant when the peritoneum around the appendix becomes what? Irritated or inflamed as well. So until the pain becomes of parietal origin, that is the only time the pain will be felt in the right iliac fossa or the right lower quadrant. And that doesn't rule out the fact that in acute appendicitis for patients, the pain can start right from the right iliac fossa. And that tells you that the pain does not always start from the periumbilical region, or the pain does not always start within the center of the abdomen. Alright, so if the migratory pain is present, we'll give a score of 1, as I already indicated. The next component is going to be the A, that is going to be anorexia. If it is present, we'll give a score of 1. Then nausea and or vomiting. Any of them that is present, you'll give a score of 1. Then we'll move to the next one, which is the T. Tenderness in the right iliac fossa. That is correlating to the McBurney sign that we spoke about in our previous video. If there's tenderness in the right iliac fossa, we'll give a score of 2. This time around, we'll give a score of 2. Why are we giving a score of 2? Tenderness in the right iliac fossa, specifically at the McBurney point, that is the site of the inflamed appendix. It is the earliest and the single most important sign in acute appendicitis, and it's more peculiar to acute appendicitis, so we'll give it a higher score of 2. The others above, they are non-specific, so a score of 1. The next one is going to be rebound tenderness. That is going to be the Bloomberg sign. If it is present, we give a score of 1, because this is not only peculiar to acute appendicitis. It can be found in other conditions, not only in acute appendicitis. The next one is going to be elevated temperature. That is temperature greater than 38.8 degrees Celsius. This one too is non-specific because there are a lot of conditions that can cause the temperature to rise. And if it is so, we'll give a score of 1. The next one is going to be leukocytosis. For the leukocytosis, we would use the criteria of the WBC count being greater than 10 times 10 to the power 9 per liter. Or if we are mathematically oriented, we will say that greater than 100,000 per microliter. And if this criteria is met, we will give a score of 2. We will give 2 in this scenario because it is correlating to the inflammatory origin of the appendicitis, telling you that there has been an inflammation. So we'll give a score of 2 to point in that specific direction. Then finally, we have the S, which is shift of the WBC count to the left, which indicates neutrophilia. And in this case, the criteria is going to be a neutrophilia greater than 75%. And this can also occur in a lot of conditions. So it's not specific to acute appendicitis. So we'll give a score of 1. Now, how do we interpret the score? So the interpretation is going to come in 3 forms. So the first one, if the total score, that is the total Alvarado score, ranges from 0 to 3, then we'll say appendicitis is less probable. Appendicitis is less probable. So what should be done? An inpatient observation has to be done, meaning the patient needs monitoring. It needs observation. And how should the observation be done? It should be done in the hospital. There should be an inpatient observation of this patient. All right. What if the total score ranges from 4 to 7? If it ranges from 4 to 7, then it tells you that appendicitis is what? Probable. It's probable. So what should be done? Further investigations has to be done. And in this case, which investigation specifically? A CT scan should be done to improve the confidence in the diagnosis. A CT scan should be done to improve the confidence in the diagnosis. Then finally, a score of 8 to 10 tells you that what? Appendicitis is definitive. There's a definitive diagnosis or definite diagnosis of acute appendicitis. And for such, surgical intervention in the form of appendicectomy or appendectomy should be done. So the interpretation again, the score of total score of 0 to 3 indicates that acute appendicitis is less probable. Patient requires observation, therefore an inpatient observation needs to be done. A total score of 4 to 7 indicates a probable acute appendicitis, and for that, further investigations are required in the form of a CT scan being done to improve the confidence in the diagnosis. Then finally, a score of 8 to 10 correlates to a definite or definitive diagnosis of acute appendicitis. And hence, for that, surgical intervention in the form of appendicectomy or appendectomy should be done. Alright, that would do for the Alvarado score. But you should know that in the clinical setting, the total score interpretation will take a different path, because there are some patients where most of these will not be present, but intraoperatively the appendix is inflamed. So clinical subjectiveness would vary with regards to the Alvarado score. On that note, we've come to the end of another interesting session. If you have any question, you can leave it in the commentary box. But don't forget to subscribe to my channel, like, share, and recommend to friends. and also comment the next concept you would like to see on my channel. My name is Dr. Del, and once again, this is Concept in Medicine. Bye-bye.